ADHD, or attention deficit hyperactivity disorder, is defined as a disorder marked by an ongoing pattern of inattention and/or hyperactivity-impulsivity that interferes with functioning or development by the National Institute of Mental Health. Most cases are diagnosed in a child's elementary school years, and it may be more common than you might think. 9% of kids in the U.S. have it. If you think your student may be one of them, here are some things you should look for according to the National Institute of Health. Is your child missing details and making careless mistakes? Having trouble with sustaining attention in things like schoolwork and in play? And easily being distracted by unrelated thoughts or things? The NIMH also says that kids with ADHD may also fidget and squirm, leave their seat when they're not supposed to, as well as talk nonstop.
Every child is going to fidget. Every child is going to have attention problems at times. The question is it unusual and does it affect their daily functioning? And so you start by watching your child.
A pediatrician, psychologist, or psychiatrist with a background in ADHD will need to do a comprehensive evaluation. They'll determine if your child's symptoms of inattention and/or hyperactivity-impulsivity are chronic or long-lasting. They'll also look at whether the symptoms impair the child's functioning, causing them to fall behind development for their age. While there is no cure for ADHD, there are multiple treatment options. According to the National Institute of Mental Health, these treatments will help reduce symptoms and improve functioning. First, you have medication. The most common type is a stimulant. It works by increasing the brain chemicals which play major roles in thinking and attention. You'll need to work with your child's doctor to find the right combination of medications and dosages. Be patient, this can take time. If your child has bothersome side effects or a stimulant medication isn't effective, your doctor may opt to use non-stimulant medications. There are also a variety of psychotherapies and psychosocial interventions, and it's more than just treating the physical. Your child may be feeling frustrated, angry, and even blame themselves. That's where mental health counselors can help both your child and your family. There are behavior therapies which can help to change behaviors associated with ADHD. Children can also learn to be accepting of their thoughts and feelings and improve focus in therapy. There's also family therapy and parenting skills training. Parents will learn better ways to handle disruptive behaviors and ways to reward positive behaviors.
I think on average, a child with ADHD needs more reinforcement, in other words, more carrots to work for, so to speak, more motivators than youth who do not have ADHD, and that's been much harder with online learning.
There are also support groups for families to connect with others with similar concerns. Here locally in Tampa Bay, there are counseling centers and behavioral health specialists that can help with evaluations, counseling, and coaching. And keep in mind that many of those therapies can be done virtually.